Hi everyone, this is Meir. After coming from a very long trip in Israel and Europe, I have a long time here to reflect and think about all the different clients that I saw, and one thing comes to my mind which is so important. A great many times we're being told to do what is deemed to be necessary medical procedures. And many times they're necessary. With one exception, there isn't the follow-up work that can prevent the need for those procedures. For example, when people have bleeding in the retina, glaucoma attacks, and many other problems, nobody trains them to do what we want to train them to do. Loosen up the neck, loosen up the back, bring more blood to the head, and prevent the situation that caused bleeding in the first place. And what's that situation? Not enough blood gets into the retina. So the body creates capillaries and they leak, and that leads to partial or complete blindness. Not enough blood gets to the optic nerve. And doctors think that only the pressure in the eye causes the damage to the optic nerve, and that is only a partial truth. And what we need is to work on the optic nerve and on more blood flow to the eye, so that would decrease the pressure and increase the drainage that causes the pressure in the first place. And often, doctors love to change the anatomy of the body. But it's proven again and again that even with a defective anatomy, you can still function better. And we know more and more that people that even have brain plaque and lost parts of the brain can still function normally with the brain that they have. It's a question of exercising and studying. I really recommend that everybody study something new much of the time. But let's continue here. I know that sometimes doctors tell people to do a cataract surgery when the vision is 50, 60, 70, even 80% of normal vision. It makes no sense. There is no surgery without a risk, and all kinds of things can happen. While if they see me and work with me, they prevent the surgery most of the time. Well, there is time when people see next to nothing because the cataract basically obstructed all the vision that they have. And I wonder why they always want to cure themselves naturally when it's very simple to simply remove the lens, put an implant, or not even put an implant, and see better. So there are times for surgeries, there are times for procedures, and there are definitely times to prevent them. Quite often, preventative procedures that medicine offers you cause more problems. We really should leave acute care to the medical profession. And whenever we're given the choice to do something or not, let's not do it. Let's work on the powers of nature. So if you look far at a distance and wave your hands to the side and scan the horizons, if you do the palming exercise that I described again and again, where you rub your hands and put your hands around the eye orbits and visualize if you see in darkness, you can prevent the onset of cataract that everybody predicts you'll have. And I think that because we look so much from near, read so much, depend on glasses, that's why we get cataracts. I think it's very, very important to get rid of the tendency to have cataracts. So, My recommendation today to everyone is trust nature and trust your body. And in all my seminars, including the 6 days that we have one coming on February 14th through the 19th, I teach people to use their inner powers to move forwards. Many blessings to all of you. Meir.